Okay, it's 10 o'clock. Let's get going with Career Spotlight Session 1 on this Step into the NHS Day. So a huge welcome to all of you who are joining. There are people still joining at the minute, so we've got a little bit of intro to do, so that's fine as people are still coming into the virtual room. My name is Abby. I'm from the NHS Health Careers team, and a big welcome to you for this second session of the Step into the NHS Day. A welcome back if you were in our welcome session at 9 o'clock this morning, but some of you might be joining this as your first session today. And we're really, really pleased that so many of you are here, so many classes of students around England joining, so from all areas of England, so it's really, really exciting, and we are very, very glad that you're here. So we have got a really exciting Career Spotlight session coming up where you're going to be meeting a couple of guests. They'll be coming online in a minute. Little bit of housekeeping to do first. So hopefully you can all hear. If there are any issues, obviously check speakers are turned up, but sometimes leaving the Teams call and rejoining sorts out any sound issues. So do give that a go, and hopefully that'll fix it. Everyone is muted and cameras are off, and just a reminder that we are recording this session, but the chat is very much open and we'll be asking you to put things into the chat as the session progresses. Okay, so we have an interactive activity for you in this session, which is always great, so that you're not just sitting there listening to stuff, you are able to take part in what we're doing. So we're going to be hearing from Alicia and Kade, and I need to be careful not to mention what they do, because your job in this session is to guess what their job role is. So they are both going to be giving you some clues, and you need to then try and work out what it is they do. Then we'll be revealing their job. Well, they will be revealing their job to you, and you can ask them live questions that they'll be able to answer in this session. So hopefully you will really, really enjoy it. So teachers, if you can be ready to gather the students' answers and put them into the chat when we get to that, that would be great. So hopefully you have got worksheets as well. So teachers, these were emailed out. Students, if you've got worksheets in front of you, or even if you haven't got a worksheet but a paper, jot down what you're learning through this session. Jot down interesting things about Alicia and Kade's jobs, and you can use this information to help you with your Step into the NHS competition entry, because that's what today is about. It's about prepping you for the competition, giving you some information, giving you some places to go to find out more. Okay, so I think that's all we want to say about what we're going to do. So let's get going. So Alicia, hopefully you are able to join us now. Let's play Guess the Job Role with Alicia. Welcome.
Thank you.
Thank you for joining us today. So Alicia, can you just say hi, and then let's get going with your first clue, please.
Yep, so hi, my name's Alicia, and I'm looking forward to participating in this event and activity with you, and hopefully you can all guess my job role at the end of it.
Right, go for it with clue 1.
Clue 1, so I help to plan and organise different healthcare projects, and I make sure everything is on track and running smoothly.
Okay, so what are you starting to think, everyone? Start to get some ideas together. What could Alicia's job be? Let's have your second clue, please.
So I work with doctors, nurses and other healthcare professionals, coordinating tasks and ensuring that everyone knows what they need to do to improve patient care.
Intriguing. Okay, so maybe this is a bit more of an unusual job role here that we're asking you to have a think about. Let's hear Alicia's third clue.
So I'm very organised, I'm good at communicating, and I love problem solving, and I have to properly manage healthcare projects.
Okay, what is everyone thinking? So some guesses coming in already into the chat, which is great to see. So let's see all 3 of Alicia's clues now, so that that helps you remember what she said. Have a chat to the person next to you, and then put your hands up to let your teachers know what your guesses are. And teachers, if you could, well, some of you are already really busy typing away, so we're just going to give you a little bit more time, but I can see some guesses coming in. So consultant, project manager, receptionist, NHS manager. I did see some others further up, but there've lots of project managers coming in. Social worker, What else have we got? Receptionist or project manager, healthcare manager, pharmacist. Lots. So it's so good to see so many of you guessing here. Human resources, chemist, physio, quite a range. Social manager, again, popping up there. Project manager, lots and lots of project manager guesses coming in here. Okay, so hopefully you've all had a chance to get your guesses in. Well done, all of you, for getting thinking on this. Shall we find out what Alicia's job role is? Alicia, could you let us all know?
Yes, so I am a project management intern.
Brilliant. So loads of you did so well there because there were lots of people guessing project manager. So well done, those of you that guessed right. But thank you everyone for taking part. There's some really, NHS commissioners, some really interesting ones coming in there as well. And it shows you're all starting to think about the range of roles in the NHS, which is brilliant because that's what we want from you. That's what you need to be thinking about when it comes to your competition entry as well. Okay, remember you might want to use Alicia's job perhaps in your competition entry. So have a think about that. Right, worksheets at the ready so that you can write down things you find out about Alicia's job now, because we are going to hear a little bit more. So Alicia, can you tell us a little bit more about what you do in your job, please?
Yeah, sure. So I work with NHS England, and within NHS England, we're designed to provide hands-on experience in various areas of healthcare leadership and policy. So we focus on the workforce training, education of the workforce. So this is us educating the doctors, nurses, physiotherapists, and making sure that they receive the right information and the right leadership advice and projects. And we also look after the healthcare of the professionals within healthcare and NHS. So we make sure that their well-being, they have good well-being. We focus on projects that promote health staff well-being in healthcare. And ultimately, I work on a diverse range of projects to support decision-making within the NHS. So I will engage with different stakeholders, including clinical staff and non-clinical staff, and we will see what staff are looking for within their job role. So whether that is well-being or whether that is educational opportunities. And then we will use that information to design and co-create projects. So we specifically design them for the workforce.
Wow, it sounds really interesting, and it sounds great that you've got a kind of a mixture of projects going on at one time as well, so that you've got some variety. Thanks, Alicia. So what's the best part about your job, would you say?
I would say that the best part of my job is that it's so diverse. So I could be supporting and assisting on various different projects. So some of my projects involve research and data analysis. So I'll look at the research statistics within the NHS and looking at the work retention levels, or I'll be looking at the staff engagement levels. And I would also be creating different resources. So I'll be developing toolkits, FAQs, reports for NHS England and colleagues within NHS England. I would also be supporting on engagement projects. So I'll be linking different stakeholders together. So that's different people within the NHS and learning about how we can improve services for patients. And just working with a range of different people within NHS England. So no day is the same and no project's the same. So you just work with people's needs and you adjust to people's needs within NHS.
Brilliant, thank you. So just a reminder to those of you watching, if you can start to get your questions coming into the chat so that you can get your questions answered by Alicia, that would be great, because we'll be coming to that in just a minute. So Alicia, just one more question for you before we go to some other ones. What are the main skills that you would say you need in your job?
One of the main skills I would say is you have to be very organized, because within my role, you might have various different projects going on at the same time, which I do at the moment. And it's important that you make sure that you schedule time for each of the projects and put as equal amounts of effort into the projects. I would also say that you need to be a good communicator to communicate with the different stakeholders that you will be working with. So that could be clinical staff one day, that could be non-clinical staff another day, it could be patient focused one day. So it's a very different style of communication with each person that you're talking to. And I would also say that you need to be quite adaptable as well, because with the changes in the NHS, it's important that you are constantly adapting to the different needs that might arise at any time. And lastly, I'd say you need to be very flexible with your time, because some things might take longer than expected. Some things might not go to plan, and obviously things are always changing, so it's important to be flexible with that, and just work with things as they are.
Brilliant. So remember, everyone, to listen out to the skills and the interests that people need to have for these different jobs, and start to think about those for your competition entry. Okay, so we're going to be taking your questions in just a second, but first of all, we have got a question that's been sent in by Scarlett from a school in Stoke-on-Trent. So we're just going to hear that, and Alicia will respond to that, and then we will get going with your questions.
Did you always know this was a career for you?
Okay, hopefully you heard that all right, Alicia. So did you always know this was the career for you?
I didn't always know it was the career for me, but during university and during my clinical placements, because I did a clinical degree, I found that I was really interested in promoting the well-being of patients and staff. And I really like the idea of getting involved in non-clinical projects which have such an impact on patient care. So you can look at different services and look at the way that services are run and say, well, this is the way that we can improve them. So I quite like that. And then now doing the internship, I've become more interested in healthcare leadership and looking at services and working with different elements of the NHS just to make sure that things are running smoothly and being part of those projects that ultimately help to benefit patient care.
Brilliant, thank you. Okay, we have got lots of great questions coming in, Alicia. We have 5 minutes. Let's see how many we can get through in this time. So someone has said, favourite part of your job?
My favourite part is definitely talking to people, talking to different people within the NHS, because everyone does such different roles and different jobs, and within my job, I get to find out more about other people's roles as well. And I quite like that, and looking at the skills that they need for their roles, looking at what they do on a day-to-day basis and trying to meet their needs as well. So that's what I really enjoy.
Brilliant, thank you. Right, Debenham High School have asked, do you enjoy your job?
Yes, I really, really enjoy my job. I feel like it's a very dynamic role, and I get to kind of pick and choose which projects I want to work on, and all the projects are around my interests, so they interest me quite a lot, so I enjoy what I do. Yeah.
Fab. And another good question here, what hours do you work?
So at the moment I'm working flexibly, so I do part-time hours, so I work from Monday to Wednesday, and that's only because I'm also studying for my master's, so I had to limit my time at work.
Okay, so there's flexibility in the NHS in terms of roles as well. That's great. Someone here, this is a good question. What's your most successful project?
Oh, so one of my most successful projects was, so within the NHS, we have EI leads, so that's equality, diversity and inclusion leads, and they focus on promoting diversity, inclusion within the NHS. So what we are doing is we're creating education toolkits and information for them so that they can do their jobs. They can have more support doing their roles. So that includes having like training resources for them, having like a peer-to-peer training support for them, and that's different things that they can access to make them feel more comfortable in their roles, and also improve EDI roles in general and EDI within NHS.
Great, thank you. Someone here asking, how long have you worked with the NHS?
So I've worked with the NHS for around a year now.
Okay, brilliant. And this is another good question. So what are the career progression opportunities in your roles? Because it's great, isn't it, when you might really enjoy what you're doing, but think, well, this isn't going to be forever. What can I potentially, what could this grow into? What could I move into in the future?
Yes, so there's lots of career progression within the NHS, and especially within my role. So I came in as an intern. And so as an intern, I'm able to work on various different projects within different sectors. and then I can decide what interests me and then apply for a role within that area. So at the moment, what's really interesting me is staff wellbeing, and looking after staff wellbeing, and also the EDI within promoting EDI within NHS. And that's something that I can then go into and focus on that specifically instead of focusing on like a range of projects. So there's loads of career progression, and you just look into whatever interests you and whatever you're passionate about, and that's always available because there's so much to do within the NHS.
Brilliant, thanks Alicia. And someone here asking how did you become a project manager and what qualifications did you need?
So with the project internship, so the internship you can apply for that online. And in terms of qualification, you just need to be studying towards, you need to have a degree. So you need to be either in your first year of university, or you can be in sixth form as well, but you need to be working towards an educational degree. And then in terms of other roles within the NHS, you would have to check. So I don't know specifically what qualifications you will need, but for mine, it's just you need to be working towards a higher educational degree.
Great. Okay, thank you. That is brilliant. So let's just have one more question before we meet our next guest. How many people do you work with in the NHS? Someone's asked here.
Wow, I work with a lot of people. My team specifically consists of around 10 people, but the people that I work with is just endless. I can't even count how many people I work with. So it's just anyone that needs the services, or sometimes it's not even people within an NHS. We have other stakeholders who also we work with them as well. So yeah, there's loads of people. You just meet different people.
Right. So you're part of that big NHS team, and that's what makes it all work, doesn't it? Great stuff. So
Yeah.
Alicia, thank you
Exactly.
for joining us. Thank you to all of you for your questions. I'm sorry we didn't have time to get through all of them, but so many good questions, and really great to see that you are thinking about these roles, and hopefully you're starting to think about your competition entry too. So thank you, Alicia. Okay, so let's meet our next guest. If you were on the welcome session earlier, you'd have met Kade briefly then. So welcome back, Kade.
Hello, it's nice to be back.
Brilliant. So we are going to play the same game with you. So let's not hang around. Let's get on with it. Let's hear your first clue, please.
Sure. So clue number one is I'm very curious. I pay close attention to detail, or try to at least, and I love using science to solve medical mysteries and improve patient care.
Brilliant. Medical mysteries. I've got a little mental image of Sherlock Holmes in my head now. What are you starting to think, everyone? Let's have your second clue, please, Kade.
Sure. So clue number two is I work very closely with doctors and other healthcare professionals to understand illnesses and find the best treatments for patients.
Okay, I can see lots of guesses coming in already, Kade. So people are really thinking about this. So let's have your third and final clue.
Sure. So it's a big one, this one. So clue number three is I work in a laboratory. Ring, ring. And I use special equipment to study samples and help to diagnose disease by doing that.
Wow. So thank you, Kade. The guesses are just absolutely flooding in here. Let's see all your clues on one slide. As you say, that last clue, that was a biggie. And I can see lots of people are making some really great guesses. Biomedical scientist, chemist, virologist. What else have we got? Healthcare research scientist. All sorts of different ones: clinical scientist, lab scientist, medicine prescriber, clinical researcher, microbiologist, analyst. Lots of really great questions coming in. So you're obviously all very busy thinking about this. Teachers, thank you for being so quick off the mark with typing those in. Kade, do you want to let us know what it is that you do? Let's have the drum roll.
Sure. So there was actually quite a few correct guesses. So I'm a clinical scientist, specifically in biochemistry or just chemistry, and a few people guessed biomedical scientist, which is extremely close, and I class that as a successful guess. And I actually used to be a biomedical scientist as well. So I think that's correct too.
Yeah, there we go. So well done, all of you. There were so many good guesses, and as Kate said, so many, so close. And definitely close enough. So well done, all of you, for that. So let's hear a little bit more about Cade's job now. So Cade, what's the best part of your job?
It's hard to put my finger on, actually, because I actually really like my job. But I think similarly to a lot of roles in the NHS, I think just how varied the job is. So absolutely no 2 days are the same. So I've got some routine aspects of my job, which is authorising a lot of complicated data that can help to. So I specifically deal a lot with cancer diagnosis. So I interpret a lot of laboratory data to help basically give the answer to the doctor if a patient likely has cancer or not. And then other days I'm on wards, going around and seeing patients with the doctors and helping them to make decisions based on their blood test results, how they can change the treatment to help them get better even quicker. And there's little bits of research elements to my job as well. It's not primarily focused on that, but I do get quite involved in that. And as well, I get to talk to absolutely tons of different types of people in the NHS, including anyone who requests blood tests, sometimes patients themselves as well, if they're a little bit confused about their blood test results, just to kind of put their mind at ease sometimes. And yeah, it's just no 2 days are the same. It really can get intense.
Well, you can, really feel the enthusiasm for your job coming through there, Kate. That sounds great. So remember, all of you listening, be writing things down, thinking about your competition entry potentially. So let's start to get questions into the chat as well, so that we're ready to go. But Kate, what qualifications did you need to get to where you are now?
So that's a really good question. So to be a clinical scientist specifically, you must have a master's degree, because you start off at band 7 as a clinical scientist in the NHS, which is a master's degree requirement. But to be a biomedical scientist, which is quite similar with a few little differences here and there, you need to go to university and get a bachelor's or a BSc degree in biomedical science. But my master's was funded for by the NHS, where I got a fully funded and paid master's degree in clinical biochemistry, which then allowed me to become a clinical scientist afterwards.
Brilliant. So funded to get your qualification. That sounds good. And what about the main skills that you need? I know some of them were kind of in those clues, but what would you say the main skills are that you're using?
Two absolutely huge ones that come to mind specifically. One, the ability to multitask is essential, because you've got so many different things going on every day, especially if you're something called the duty biochemist, which is when any issues in the lab of that day come straight to you, and then you're trying to do about 10 million other different things at once. So you have to be able to multitask and prioritize what you need to do in the interests of patient safety, basically. So that's a really big skill. And the other big one, attention to detail, is essential. Data we generate, more data than I can even comprehend every day in the laboratory, and you have to have that attention to be able to pick out something that might actually affect a real patient, and then to bring that to light so the patient can get the help that they need. But yeah, attention to detail, absolutely essential.
Great. Thanks, Kate. Right, we have got so many good questions coming in for you, Kate, but just before we do that, let's just hear that question from Scarlett in Stoke-on-Trent again. And Kate, if you could answer that one, that would be great. So let's hear Scarlett's question.
Did you always know this was a career for you?
So again, good question. I guess always is a long time. I would say probably not. So when I was a teenager, I thought I wanted to be a doctor. And then I did loads and loads of work experience in hospitals, which I'd encourage anybody to do, regardless of the career they want to do. And then I actually thought about it and thought, I don't think this is for me, but I really still love science. So I was looking at science careers and I was like, what can I do? And then I actually settled on going into research. But then I really wanted to actually have a more practical and healthcare application to my job. So I just did a bit of research just before I went to university when I was about 17 years old, and then found biomedical scientist / clinical scientist, and then thought, you know what? That is exactly what I want to do. I think I want to use science in a healthcare application to help people every day. So then I picked my university degree when I was about 17. So going back to about 16, 17, yes, I think this is the job I wanted to do. And I haven't been disappointed yet. So
oh wow, well that's good. That's good to hear. And that must have been a wonderful feeling when you kind of thought, yeah, this is it. This is the one. Okay, so let's go. We've got so many questions, so let's crack on and see how many we can get through. We have got, Kade, we have got 6 minutes. Okay,
yeah.
So let's see, how many years did you do your courses for? Good question.
So my degree was 4 years because I did a placement year. So this is my Bachelor of Science degree. So that was 4 years. And then the Masters, which was I was working alongside doing my Masters, that was an additional 3 years. So that's 7 years in total. But I'm currently working towards my consultancy exams. And that's the equivalent of another couple of years, probably at least, of training on top. So it's a long time for 5, 6, 7, 8. You're looking about 10 years to fully complete the whole pathway.
Wow.
So,
okay.
But yeah, to enter as an entry-level clinical scientist, you're looking at a minimum of 6 to 7 years of direct full-on training.
Okay, so you have to want to do it.
Yes.
Okay, so a question here from Royds Hall School about what did you do for your GCSEs, if you can remember that, Kate, because we'll have students here now who will be coming up to choosing GCSEs potentially, so an important question for them.
So GCSEs, I am, in my opinion, but definitely take your teacher's advices here because it's been a long time since I've been in school. But so I think your GCSEs, as long as they cover the maths and the sciences, then you will have all of the information and knowledge you need for this career specifically, for sure. And then if this is definitely the path you want to go down, some other useful GCSEs, I'm not sure what the options are now, to be honest, but I think it's mainly just getting your core maths and core science covered, which I think you have to do anyway. And English, of course. Get your
English in there.
Absolutely. And English, of course. English is always important. So yeah, but I think in terms of direct application to this job, any other GCSEs that you can pick, I think are probably definitely take your teacher's advice on that. IT is a very good thing to do because a lot of things are becoming computer assisted now, which is a good thing because too much data hurts the brain. So but yeah, IT can also be very helpful.
Brilliant, thank you. Right, a question here, how many tests or samples do you deal with on a typical day?
Fantastic question. So our laboratory is a medium-sized laboratory and we receive through our front door about 3,500 samples a day. So so a lot of them can be automatically dealt with. So I'm not touching 3,500 samples a day because there's just not enough seconds in the day to do that. So personally, I'm very heavily involved in probably about 300 of those samples every day that I have direct involvement with, and will have some influence over the outcome of those patients if it's needed.
Okay, so still a huge number that you're directly involved with. Okay, thanks, Kate. Good question here. How do you handle errors or mistakes in the laboratory?
That's a really, really good question. So they do happen. We try and make sure they don't, but they happen, especially when things are changing and you're doing new stuff to improve patient care. Mistakes do happen. Being honest is absolutely essential. So as soon as you discover the mistake, you must own up to it. So that's what we do as a laboratory. We contact whoever is involved in that patient's care, if it's a specific patient, for example, that we have made a mistake with, and we own up to the mistake. And then we do, so a big part of my job actually is assessing the situation and making a decision on how that mistake may have actually clinically affected that patient. And then we have to make a decision on how to correct that mistake. But in all, it's absolutely essential is being honest upfront about it, and then being honest about what you're going to do to correct the situation for them and to stop it from happening again in the future as well.
Thank you, Kade. That's a great answer. A few questions in here about salary. Yep. So we're certainly not asking you to disclose your exact salary, Kade, but are you able to kind of give perhaps a ballpark in terms of clinical scientists and pay?
Yeah, so I mean, NHS salaries are public knowledge anyway. I have no sensitivity about discussing it at all. So biomedical scientists, which you just need a bachelor's degree for, and you can do that in chemistry, they'll start at band 5, which currently sits about £30,000 to £35,000, and then you can make your way up. So going up management as a biomedical scientist, and then typically you can go up to about an 8A salary, which is about £53,000 currently to £60,000. Clinical scientists, because of their extra training, start on band 7. So I started on band 7 a few years ago, and that starts at about £45,000, and that will go up to £52,000 after experience. But I'm currently an 8A because I've got a bit more responsibility and a bit more training, which is currently just shy of the £60,000 a year mark.
Okay, thank you, Kade. And I know, you know, it's part of decision making, isn't it, around careers? Actually, is absolutely. You know, we all have to pay the bills. Okay, I think we have got time for one more question, and you have touched on this a little bit already, but it's about career progression. So someone kind of asking where could your career take you?
But really good question. So you start off kind of doing more routine authorizing of important results as a band 7 entry-level clinical scientist, and then you go on to sit some very, very, very difficult exams called the Fellow of the Royal College of Pathologists exams, which I'm currently sitting right now. And that will qualify you to become a consultant clinical scientist. And once you're at that point, if you are a consultant in a laboratory, you basically run the laboratory. So it's your decision about what tests you do, how you do those tests, and any other direction you want to push the lab in. It's up to you. You're the consultant and you run the place. So but you need to have your final qualifications to do that, and that typically from start to finish will take the average person about 12 years to get to that point. But the progression, but you don't have to do that either as well. Most of my friends actually who are in the same job actually so they qualify as a band 7 clinical scientist after their masters, and they stay there and they just do that, and that's completely fine. But if you want to reach for the stars and put yourself through a lot of stress and pain with further exams, you can absolutely do that.
Brilliant. Well, we wish you good luck, Kade, in those exams. I'm glad I'm not having to do those. Okay, so absolutely brilliant to hear from Alicia and Kade. 2 very, very different jobs, and you'll have learned lots of interesting facts about both of them. Again, sorry if we haven't got round to answering your questions. So many good questions. Thank you for putting those in. Okay, so we're just wrapping this session up now. Teachers, remember that you can potentially use this time now for the 1 lesson launch. So all the information you need to launch the competition, the Step into the NHS Day competition, is there. It includes the competition video, so a short video that you can watch that tells you everything you need to know about running the competition in school. Remember, you've got till the 30th of April to get entries in. So thank you so much, everyone, for joining this session. So many of you, it's been so good to see so many of you joining, so much engagement in the chat as well, which is great. Our next session we have got is at midday, so just under an hour and a half. You're going to be helping to solve an NHS challenge, and you're going to be joining Charles and Izzy, who are going to be helping you out with that. So we'd love to see as many of you as possible. Remember, it's the same Teams link that you joined, so you don't need something different for the next session. You just use the same Teams link that you have used before. So between now and then, start to think, what NHS career do you want to find out more about? What NHS career might you use to do your competition entry? So perhaps you want to use Alicia or Kade's job roles as inspiration for that. So have a look at the Step Into the NHS website. Lots more inspiration and information on there. There's the Career Mapper quiz on there as well. If you've got any questions about the competition or about careers, we do have a contact centre, and the details will be in the chat, so you can contact us through the contact centre at any time, and we can get responses back to you. So thank you again for joining, and hopefully see lots of you at midday. And thank you again, Alicia and Kade, for joining us today. See you later.